This is the VOA Special English Technology Report. A talking kitchen teaches students how to cook French and speak French. Researchers at the Newcastle University in Britain have developed the French Digital Kitchen. Professors Paul Seedhouse and Patrick Oliver led the project. Professor Seedhouse says it works like a satellite navigation system in a car. The sat-nav speaks to you, and it tells you, for example, to turn left. And if you turn left, then it continues with the program. If, for example, you turn right, then it's a mistake. So it loops back and gives you further instructions. The kitchen equipment and tools use motion sensor technology, similar to the Nintendo Wii game system. The sensors help a computer guide the students through instructions in French. The system can tell whether you've done what you were asked to do or not. So let's say, for example, the system tells you to take some butter and cut it with a knife. The sensor in the knife not only knows that the knife is moving, but it also knows what motion the knife is making. Students can ask the computer to repeat the instructions or translate them into English. There are vocabulary lessons before and after the cooking. Professor Seedhouse became interested in the idea after he visited a talking kitchen designed for a different purpose. It was actually for communicating with people who suffer from dementia. It can tell them, for example, that they've left the oven on. He says the French Digital Kitchen turns the process of learning language into a real-life experience. But the idea, known as task-based language learning, required a few changes as the researchers were designing the system. For example, if they had a sink full of water, as soon as people finished cooking with an instrument, they would throw it into the water. And for us, that's deadly, because the digital sensors were immediately ruined. The system could be available for sale by the end of 2012. Adding the technology to a new kitchen could add an estimated 10 to 20% to the building costs. The system could also be added to an existing kitchen. The researchers are also developing portable versions, and the European Union has given them money to begin programs in 6 other languages, including English, Italian, and Spanish. For VOA Special English, I'm Carolyn Persutti. You can find links to videos about the Talking Kitchen at voaspecialenglish.com. From VOA Learning English, this is the Technology Report. The United States has announced a plan to fight the growing threat from cyber spies and internet attackers known as hackers. United States Attorney General Eric Holder says the Justice Department is fighting back aggressively. He says the department is working with states and federal agencies to bring to justice those involved in online theft and espionage. Mr. Holder called for increased cooperation with private businesses. He also noted the need to protect trade secrets. The Attorney General said a single trade secret can be worth millions of dollars. Stolen trade secrets, he said, hurt businesses, jobs, and economic competitiveness. The new policy calls for fines and trade action against individuals and countries that target U.S. trade secrets. The plan was announced the day after the American information security company Mandiant published its investigation of cyber attacks. It reported that more than 140 companies have been attacked since 2006. The targets include some of the biggest companies in the United States, such as Apple, Facebook, Lockheed Martin, and Coca-Cola. Mandiant says hacking groups in China carry out most of the attacks. They include groups known as Comment Crew and Shanghai Group. Mandiant also identified something called Advanced Persistent Threat 1, or APT-1. It says APT-1 is a part of the Chinese military, the People's Liberation Army. Mandiant says the Chinese government also wants to hack into important parts of America's infrastructure. China's foreign ministry denies Mandiant's accusations. It calls the report irresponsible. For VOA Learning English, I'm Carolyn Presutti. This is the VOA Special English Technology Report. Nurses spend their lives helping other people recover from injuries and illnesses. Yet nurses suffer a surprising number of injuries and illnesses themselves because of their work. In fact, the United States Department of Labor says nursing is the second leading profession for on-the-job injuries. It ranks higher than construction work and law enforcement. Only freight and stock movers report higher injury rates. Nurses and other healthcare workers do a lot of heavy lifting on the job. Lifting and moving patients improperly leads to sprains, strains, and muscle tears, leading causes of injuries to nurses. Gretchen Gregory is an instructor at the Sinclair School of Nursing on the Columbia campus of the University of Missouri. She says back problems are the greatest threat that nurses face when they lift or move patients. You're talking about people that have handicaps or limited mobility that need much assistance. And we have untrained people to do that assisting, and that puts them at risk for hurting their backs. Ms. Gregory leads a new training room where nurses can learn to keep themselves and their patients safe. She says most nurses lack training in how to lift patients. That's not something that we teach in school, but that's when falls happen, and that's when nurses get hurt. The Safe Practices Room has special training equipment, including a life-size mannequin doll. This patient can be filled with water and made to weigh as much as 159 kilograms. Ms. Gregory says most American hospitals have lifting equipment to help nurses move patients. But she says the equipment is often pushed back in a corner somewhere, unused and forgotten. She says the Safe Practices Room teaches the importance of using the tools and skills available. The training room also seeks to improve communication skills and other practices in a setting designed to copy a busy hospital or clinic. As Gretchen Gregory puts it, If we provide an environment where everything's nice and quiet, and they can give their medications or they can communicate to a physician when there's nothing going on, that's not really a real-life setting. They have to be able to do it with some distraction. An unidentified donor gave $300,000 to build the new room. The University of Missouri describes it as one of the first of its kind at a nursing school in the United States. You can find pictures of it at voaspecialenglish.com. For VOA Special English, I'm Carolyn Presutti.
This is the VOA Special English Development Report. A medical aid program in Kenya offers hope to women and girls suffering from a condition known as fistula. About 2 million women and girls worldwide have the condition. There are about 1,000 new cases of fistula each year in Kenya, and as many as 100,000 worldwide. Most cases of fistula are in Africa and Asia. In July, the African Medical and Research Foundation held a medical camp in Kenya to provide free operations to those with the condition. A fistula is a hole that develops between two organs. Obstetric fistulas are caused by obstructed childbirth. When a baby's head is stuck in the birth canal for an extended period of time, it cuts off the blood supply to the woman's surrounding organs. This causes the tissues to die. The woman is left with a hole between her vagina and her bladder or rectum. This causes her to continuously leak urine or feces. It may also prevent her from having other children or having sexual relations. If left untreated, fistula can cause other health problems. These include skin infections, kidney disorders, and even death. Many women suffer intense shame and social rejection because of their condition. Rose Opio developed fistula during childbirth 23 years ago. She said, "I had many problems. I could not go to my farm or conduct my business. There was nothing I could do. When you have this kind of a problem, you can only take care of your body. There is nothing else you can do. People hated me." Many fistula sufferers are rejected and abandoned by their family and friends. Mrs. Opio's husband left her and married another woman. Mrs. Opio was among the women who visited the free medical camp in Kenya to have operations to correct their condition. The World Health Organization says the simple operation can cure up to 90% of fistulas. The organization also says fistula can largely be prevented. It advises girls to delay their first pregnancy until their bodies have fully developed. This reduces the risk of long and obstructed childbirth. The organization also calls for an increase in quality health care and an end to harmful traditional practices like female genital cutting. And that's the VOA Special English Development Report. Transcripts, MP3s, and podcasts of our reports are at voaspecialenglish.com.
This is the VOA Special English Technology Report. More than 280 million people around the world have vision problems or are blind. The World Health Organization says 9 out of 10 of them live in developing countries, and 80% of the problems can be prevented or cured. Uncorrected cases of nearsightedness, farsightedness, and astigmatism are the leading cause of vision problems. These are called refractive errors. They often go untreated in countries with limited healthcare systems. But researchers at the Massachusetts Institute of Technology have developed a new way to identify eye disorders with a smartphone. They call it Netra, which means eye in Sanskrit, but stands for Near Eye Tool for Refractive Assessment. A person downloads software to a phone and attaches a plastic eyepiece over the screen. The user looks into the eyepiece and uses the buttons on the phone to move 2 lines until they appear together. The person's vision problem is identified by the number of clicks required to line up the images. The results can be sent to an eye doctor to make glasses. The cost is $2, and the researchers say the results are as good as a traditional eye exam. The phone app is still being tested and is not yet available. But the researchers from the MIT Media Lab recently won first prize in the Vodafone Americas Foundation Wireless Innovation Project. They will receive $300,000 over 3 years to continue their research. June Sugiyama is director of the Vodafone Americas Foundation. She says the competition involved nearly 100 projects that offer creative ways to use wireless technology to solve problems. Second place went to Smart Diaphragm, a wireless system for women with high-risk pregnancies. It warns if there are signs that the baby could be born early unless doctors intervene. And third place went to a solar-powered wireless system designed for tuberculosis treatment programs in developing countries. Cool Comply measures the temperature of medicine and records the amount used. June Sugiyama points out that certain drugs have to be kept cool, and in developing countries, refrigerators aren't that accessible. The information is sent to local healthcare workers supervising patient treatment. For VOA Special English, I'm Carolyn Prasuti. You can download MP3s of Special English programs and find English teaching activities at voaspecialenglish.com.